Welcome back. Today, the Department of Health and Human Services announced it would begin taking steps aimed at ending transition-related care for transgender minors nationwide. One of those steps, prohibiting hospitals who participate in Medicare or Medicaid from providing puberty blockers, hormone therapy, and surgeries to minors. Today's moves come as the Trump administration has aggressively pursued restrictions against transgender care, and after the House passed a bill to criminalize gender-affirming care for minors last night. Earlier this year, the Supreme Court upheld state laws banning transgender care for minors. And today, Health and Human Services Secretary Robert F. Kennedy Jr. waved off concerns about any potential lawsuits. Take a listen.
The number of lawsuits with my name on it right now is almost beyond counting. So we have, we got everything that we do here. We have excellent general counsel. We know what we did, what we're doing is legal. And if people sue us, they're welcome to, but we're going to win the lawsuits.
Meanwhile, the Department of Health and Human Services announced yesterday it was terminating grants to the American Academy of Pediatrics, which sued Secretary Kennedy over vaccine policy. Joining me now is NBC News medical reporter Erika Edwards. Erika, thanks so much for being here. So the HHS announcement is focused on regulation around Medicaid and Medicare funding. Talk about why this is an effective mechanism from the department's perspective, they believe, to address this issue.
Hi, Kristen. So the folks I've talked with said that this is really the only way the administration can make such changes without going through Congress and having to pass a law to cut funding. What's also really notable here is the change to who should be included under the Rehabilitation Act of 1973, right? That was the first major law banning discrimination against people with disabilities. Instead of including a group this time, this proposal is actually excluding transgender people from that Civil Rights Act. Kristen?
So how else is the administration targeting transgender-related care for minors in today's announcement, Erika?
Yeah, HHS has also said it's issuing warning letters to 12 manufacturers and places that sell breast binders. These are devices used for people who have undergone surgery for breast cancer. HHS wants to make sure that these devices are not used for people going through gender dysmorphia. Kristen?
Well, we also heard officials talk about transgender identity as an ideology. What are the implications of that?
Right. So, transgender adults have actually been targeted from day one of this Trump administration's second term, barring transgender people from updating their passports, removing all mentions of transgender people from government websites, as well as barring transgender people from athletic events. Kristen?
And could this have an impact on transgender health care across the country?
It could. Nearly 24 hospitals have already stopped providing this kind of care, and now the remaining ones are likely to stop as well. So if you look at sort of the trans care landscape across the country, we're left with doctors in private practice. So that means only families who can afford to access that kind of care or to travel to those doctors are really going to be the only ones able to access that care moving forward. Kristen?
All right, Erika, thank you so much for your reporting. We appreciate it. Joining me now is Dr. Peter Hotez, co-director of the Texas Children's Hospital Center for Vaccine Development and Dean of Baylor University's School of Tropical Medicine. Thank you so much for joining us, Dr. Hotez. We really appreciate it. So let's start by just getting your reaction to a different issue, which is the grant cuts to the American Academy of Pediatrics, or the AAP. What kind of impact do you think that might have?
Yeah, I mean, when you look at the grants that are actually being cut, I mean, tell me what you're against. I mean, it's supporting addressing birth defects, fetal alcohol syndrome, newborn hearing screening. I mean, this is about as mom and apple pie as you get. So why they're doing this certainly is not grounded in biomedicine or evidence-based science. There's clearly another agenda there, and this is part of a greater erosion that we're seeing in maternal and child health. I mean, their foot in the door was around vaccines, and And every week they come out with a new zinger that, again, is not based in science, that is seeking to tear down our national vaccine ecosystem. And now measles has come back, and whooping cough, pertussis has come back, and the others will follow. And so, when you look at what's being done here, it's not any individual one thing. It's this steady drumbeat of actions that are clearly detrimental to the health of America's children.
When you talk about why this may have been done, we do know that the American Academy of Pediatrics sued Secretary Kennedy over just that, his vaccine policy. Do you think that this may be retaliation?
Well, it certainly could be, and the timing would suggest that that's a real possibility. Although when you look at the grants that are being cut, I haven't seen any specifically related to vaccines. As I say, it's something that I think any American would agree upon. Meaning birth defects and newborn hearing screening and fetal alcohol syndrome, and who doesn't want to do something about this? So if it is out of spite or is in retribution, it's doing it at the cost of the health and welfare of America's children.
We've talked to a number of doctors, former CDC officials, who say that people should look to their pediatricians, their professional medical organizations, for advice about vaccines and public health. Is that how you see this moment? And what does that mean about the public's faith in institutions like the CDC?
Well, unfortunately, and it's if you tell me a year ago, I'd be saying this, that we can no longer depend on the Centers for Disease Control, or for that matter, I think FDA and maybe other agencies, to do what's best for the American people. It's all about ideology. And so, we've never been in this situation before where we can't count on the federal government for reliable information. So I think everyone is scrambling to figure out what makes up the gaps, and the American Academy of Pediatrics clearly has taken a lead to try to help fill some of those gaps. My colleagues Mike Osterholm and Bruce Gellin have created this vaccine integrity project out of CIDRAP, a policy center based at the University of Minnesota. You're starting to see now coalitions of states band together to compare notes to create this need for a parallel entity. So there's now a coalition of northeastern states, including Massachusetts, New York, Connecticut, New Jersey. You're seeing western states band together, and it's all to try to figure out what you do given the collapse in the intellectual and scientific integrity of the Centers for Disease Control and other agencies soon to follow.
And Dr. Hotez, let me just switch gears here and ask to get your reaction to the administration's announcement today is aiming to crack down on transition-related care for minors. What do you think the implications of this are?
Yeah, this one, Kristen, is not in my expertise. I try to stay. I create a big lane around vaccines and autism and research on infectious diseases. I'm a pediatrician scientist developing new vaccines, so it's hard to know. But I think what we have seen is this broader assault against the health of America's children, and ideology is put in front of all of that, and we've never done that as a country. We are a nation built on the greatness of our research universities and medical schools and academic health centers, and we've always deferred to those entities with great success. So why now put on this whole new MAHA agenda, which is first and foremost decides what the agenda is, and then tries to manipulate the science or gaslight the American people into thinking that things are not science-based, and it's so self-defeating for the country.
All right, Dr. Peter Hotez, thank you. We always appreciate your perspective and expertise. Appreciate your joining us.
Thank you.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.